Hi, my name is Rick Olderman, and I'm a physical therapist and somatics practitioner, and I want to talk to you about why we have chronic pain, what's going on, why can't we just heal quickly, why do some people heal quickly and others not? Well, we have, our bodies are comprised of very complicated systems. We have a musculoskeletal system, a nervous system, an endocrine system. We have our visceral, heart and lungs. We have an immune system, and you can think about our mind as a psychological system too. So our body works as a series of ever-expanding integrated systems. And what I mean by that is, yes, you can look at one joint and see how one or two muscles affect that joint, but then you can look one or two more joints away from that and see how those muscles might be affecting that joint. And so you can keep looking further and further away from the source to understand how things far away can be affecting things locally. We have a certain way that our body is wired that also can contribute to chronic pain too. And by this I mean that our viscera, which means our guts, our lungs, our heart, our intestines, things like that, all have nerves that go to specific levels of our spine. And those levels of the spine share an innervation with nerves that are going to our muscles as well. So if something is wrong with our viscera, that can irritate or sensitize those nerves that are traveling to those vertebral levels in our spine, which then in turn irritate the nerves that lead to our muscles. An example of this is if we have a heart issue. Oftentimes with a heart issue, we'll feel pain in our left shoulder, neck, jaw, or down our arm. And that's because of the shared intervention at that level. And here's what I mean by this. Here are various organs in our body, and if you trace the innervation of these organs, you'll see that they happen at the same levels. And for instance, here's the heart that we just spoke about. They happen at the same levels that innervate our upper extremity, our jaw, and our neck. And so you can look at this all over the body. Oftentimes you'll have liver, spleen, or pancreas issues that might relate to back pain. And so it's important to keep this in mind that if you have symptoms in your intestines or your heart or your lungs or so forth that you thought had nothing to do with the pain that you're feeling in your body, well, maybe there is a connection there, and you should have those checked out by your doctor to see if there's something going on with the viscera too that may be influencing your musculoskeletal pain. So contact your doctor first. All right, now psychological issues can also create or contribute to pain. And this is via a network of fascial and autonomic and immune systems. And I've made a little video about that called Stress and Chronic Pain, so you can check that one out if you want to see more about how that pathway works, as far as I can tell anyway. And then with regards to the musculoskeletal system, a lot of practitioners assume that if I have pain in my shoulder, then the problem is in my shoulder. But that's not necessarily the case. It's true with some simple injuries and tears and things like that. But if you're having chronic pain and people are having a hard time helping you figure this out, well, then you're probably not looking far enough away from that site of pain to understand how the system is working together. And that's frankly what the Fixing You Interactive Clinic is all about. It's helping you understand and fix the system that's feeding the vulnerability that you're having that's creating your pain. So what am I talking about here? Well, if we look at, for instance, a flat foot or a foot that pronates, when that drops down, it causes the knee to internally rotate and then causes that side of the pelvis to drop down, creating an asymmetrical pelvis, which can create stress at the spine. And so this is a very common pattern of things that I see in my clinic, where someone will have an uneven pelvis and rib cage, and oftentimes, we'll find that there are issues in the lower leg or upper leg that are contributing to the formation of this pattern. And there are postural issues that can be happening that can create to excessive stress in the curvature of the spine too. So here are some other examples of more systemic issues that might be affecting your pain. If we look at the trapezius muscle here, it is the primary mover and stabilizer of this shoulder blade here, and if it's not working well, then we're going to have shoulder problems, we're going to have elbow problems, neck, headaches, jaw issues. This is an example of how fascia connects our body. If we look at fascia connecting all the way from the foot, and fascia is just connective tissue, it connects all these muscles, ligaments, and so forth all the way up to our neck. So issues down here can affect the neck by virtue of this fascial highway. If we look at things like the latissimus and the lower fibers of the trapezius, if these are tight or overly contracted, these will strongly influence whether you have shoulder or neck or headaches or even elbow pain. How we walk creates a pattern of contraction in our waist that can strongly influence back and pelvic and hip pain, even knee pain. And then another one about the latissimus, if the latissimus is too tight and you frequently raise your arm above head for any reason, then that's going to cause the back to arch, which then can cause back pain too. So these are just a few examples of simple connections from further away that people might not have been looking at in you. So if you have chronic pain, don't assume that you're broken. You're not. It's just that you haven't been looking in the right place. Your body wants to be better. You just haven't been given the right information yet. A frequent comment that I hear in my clinic is, my patients just can't believe that it's that simple, but they just didn't have the right information. Well, what about disc bulges or facet issues, arthritis, disc herniations, things like that you've seen on an MRI or an X-ray, and people have said, oh, well, this is why you're having pain, you've got a disc bulge or what have you. Well, frankly, I see these all the time in my clinic, and we get people better, even with these issues, which tells me that these issues, in many cases, aren't the cause of the people's pain. They may be a symptom of the functional issues that are causing their pain. So I don't think that these things happen naturally. I think they happen as a consequence of us using our bodies incorrectly, which creates excessive stress in these tissues, and then the tissues change because of it. And if we can fix those functional issues, then we can fix our pain. So first, it's important that you understand why you're having pain. If you have visceral issues, or you thought these things were unrelated to your musculoskeletal pain, then go visit your doctor and see if there's a true connection here. In this program, in the Fixing You Interactive Online Clinic, you're going to go through Lesson 3, and you'll be testing to see what is going wrong and what we need to work on. After that, Lesson 4 addresses stretching. Lesson 5, taping. Lesson 6, we need to change how you're using your body. We're going to change your habits and help you identify what's going on here. Lesson 7, strengthening. Lesson 8 is somatics. And chronic pain is often a function of excessive tension in the body. And so somatics will be a very powerful lesson to help you understand how to release that tension. In Lesson 9, I have some odds and ends. These are funky little things that don't quite fit in any other lesson, but they have made a big difference in a lot of my clients. And in Lesson 10, Practitioner help. These are hands-on techniques that I use in my clinic to help my patients and my clients. And so these are intended to help your medical practitioner help you. Lesson 11 is advanced somatics, and Lesson 12 is advanced strengthening. So that's basically what we are going to do in this program to help get you out of this chronic pain and solve your problem. I hope this sounds good to you. It really works, and I hope you give this a try. So thanks for watching, and good luck. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the Interactive Online Clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.